Hello, good morning. My name is Elizabeth Carter, a student family nurse practitioner at the University of Memphis, fall 2005. Today is Sunday, October the 26th, 2005, and today I'll be performing a head-to-toe assessment on a patient. The patient name is Mario. He has already identified himself, name and date of birth. The patient appears to be in no acute distress. He's alerting origin times 4. He's sitting upright on the examination table. The first thing we want to do, we're going to scan the room before we get started, making sure there's nothing that will impose my integrity. So we have the walls here, the ceiling, and the walls. The area over here. Surfaces. All right, so the first part of the exam, we're going to start off with the skin, looking at the patient's the head, the face, and the neck, the interior and posterior chest, his abdomen, the upper and the lower extremities. We notice that there's no bruising noted, the color is appropriate for ethnicity, there's no active lesions, there is no edema, the moisture is dry, there is no nevy, there is no scarring, the texture is smooth, the temperature is warm, and there is no skin turgor bilaterally. Next, we're going to move over to the patient's head. We notice here that the patient's head is midline, it is normal cephalic and straight. We're going to look at the patient's scalp and hair. The hair is evenly distributed throughout. It is black, it has waves. We're going to palpate for any tenderness, which we notice is not there. No infestations, no masses, lesions, nor depressions. Next, we're going to palpate the patient's temporal arteries, and there are 2+ bilaterally and no tenderness noted. We're going to palpate the patient's TMJ. Can you open your mouth for me? All right, great. So no crepitus, no sublimation nor tenderness. Next, we're going to palpate the patient's lymph nodes. We have the pre-auricular, the post-auricular, the occipital, the tonsillar, the submandibular, the submental, your posterior cervical, your anterior cervical, and your supraclavicular. So all lymph nodes are non-tender, not enlarged. Next, we're going to move over to some cranial nerves. So the first cranial nerve we're going to do is the trigeminal nerve. So what I want you to do, I want you to I'm going to clench over your masseter muscle, so you act like you're chewing for me. All right, so that's a strong sensation and equal. Next, I'm going to test the sensation part of that. Tell me where I'm touching you.
Forehead, nose, cheek, and chin.
All right, so sensations is intact. Next, we're going to move over to cranial nerve 7, which is your facial. So I want you to raise your eyebrows for me. Can you smile? Can you frown? Can you puff your cheeks? Can you pucker your lips? So cranial nerve 7 facial is intact. Next, we're going to move over to the patient's ears. We're noting that the ears bilaterally, the pinna and the tragus are both midline. They're straight. There appears to be no active lesions or discharge that we notice that are coming out. We're going to look inside that patient's ear. So the tympanic membrane is pearly and gray and intact on the right ear, and it's pearly and gray intact on the left ear. We're going to test for some hearing. Cranial nerve 8, which is an acoustic nerve. So I want to do the whisper test. I'm going to whisper something. You tell me, what do you hear?
1, 2, 3.
The right ear, and then the left ear.
1, 2, 3.
All right, so hearing is intact. Also for the hearing, we want to test what we call the Weber's test. So just tell me when you hear the sound and when it stops on both sides.
It stopped.
All right, so sound lateralizes laterally on both sides. And next, what we're going to do is the Renee test. So I'll put this on your mastoid bone and then 2 centimeters away for your right. And same thing here. So we know that air conduction is greater than bone conduction for the Renee test. Next, we want to move over to your eyes, sir. So with your eyes, we know that the eyebrows, the eyelashes, the papilla fissures, the conjunctival is pink, the sclera is white. We're going to just look here at your eyes. It appears to be no lesions or discharge or anything noted. We're going to look inside the eye. So we know that the red reflex is present. There appears to be no internal structures or anomalies there. We're going to test for cranial nerve 2, which is your optic nerve. So I want you to tell me the smallest line you can read with your left eye.
L, T, F, F, H.
All right, and then the other eye, sir.
LTFFH.
All right, so that's 20/20 vision in both eyes. Next, we want to test for cranial nerve 3 with your oculomotor, and that's touching your central and peripheral vision. So I want you to tell me what fingers I'm holding up.
2, 2, 3, 3.
All right, and can you tell me when you can see my fingers?
I can see your fingers.
All right, great. Next, we're going to test for the extra oculomotor muscles with a cranial nerve 3, which is your oculomotor. Cranial nerve 4 is your trochlear. Cranial nerve 6 is your abducens, and that's your extra oculomotor muscle. So we're going to test the 6 cardinal fields of gaze with that. So I want you to follow my fingers. All right, so extra oculomotor, so that means that those cranial nerves 3, 4, and 6 are intact. Next, we're going to test for accommodation and convergence. I want you to look at the point of the wall for me. All right, and then I want you to follow my finger inward. All right, and that's expected. No nystagmus doing that. The next thing we're going to do, we're going to look inside the eyes, looking at testing for direct and versus consensual or pupillary response. So direct is when the light is shown directly into your eye. Open your eyes a little bit wider for me, sir. Great. And then consensualary is when the light is shown into the eye, but the other eye reacts in response to that eye. So direct and consensual pupillary response is expected. All right. The next thing we're going to do, we're going to move over to your nose, sir. So with the nose, we know that the nose is midline and is straight. There appears to be no active lesions or discharges sticking out. We're going to test cranial nerve 1, which is your olfactory nerve. We're going to test for patency of that. So I want you to occlude and sniff one nostril for me, sir. All right, and then tell me what you smell.
Alcohol.
Okay, and the other one?
Alcohol.
So cranial nerve 1 olfactory is intact. Next thing we want to do, we want to palpate your frontal or your maxillary sinuses, and there's no tenderness noted there. The next thing we want to do, we want to move over to your mouth. So with the mouth, we're looking at the mouth, the teeth, the gums, the salivary ducts, the buccal mucosal, looking for tonsils grade of 2, the soft palate, the hard palate, the tongue, and under the tongue, and there appears to be nothing or normality shown in the mouth. I want you to stick out your tongue for me and say ah. So we noted that the uvula line is midline and the gag reflex is intact. Stick out your tongue again and wave it side to side. And going back to cranial nerve 9, which is the glossopharyngeal, cranial nerve 10, the vagus, that was the prior cranial nerves. So when you stick out your tongue and your tongue waves side to side, that's cranial nerve 12. Do that for me again, sir. Thank you. Cranial nerve 12, which is your hypoglossal nerve. That's when the tongue is midline, and that's no fasciculations noted with that. The next thing we're going to do, sir, we're going to move over to your neck. So with your neck, we're noticing here that we have the trachea here. The trachea is midline. We're going to turn your neck from side to side, and we're going to palpate the thyroid. And there appears to be no enlargement with the thyroid. Thank you so much, sir. Next, what we're going to do, we're going to palpate your carotid arteries, and then we're going to listen to them. So your carotid arteries are 2+ bilaterally, and notice no tenderness is noted. Then we're going to auscultate for any bruise. All right, so no bruise notice with the carotid arteries. The next thing we want to do, so we're going to have you to turn around here and look at your posterior chest. So with the posterior chest here, we're looking at the chest wall. The chest is symmetric. There appears to be no signs of respiratory distress, no use of accessory muscles, no cyanosis, no tripod position, no tachypnea, and no nasal flaring. So the first thing we want to do is going to do tactile pharyngesis. Say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, great. The next thing we're going to do, we're going to listen to you, listen to your long sounds, and take a deep breath in and out for me. All right, so the long sounds are clear to auscultation. There are no adventitious sounds. The next thing we want to do, I want you to say 99, and I'm going to listen to you. This is bronchophony.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, and then we're going to have you say the letter E, which is egophony.
E, 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 E.
And then the last test we're going to do is a whisper rectally, which you're going to whisper 1, 2, 3. 1, 2, 3. And with those 3 tests, we do not notice any abnormalities. Okay, next thing I want you to do, I want you to turn around for me. We're going to look at your interior chest. So with the interior chest, again, we're looking for any deformities, which we do not note. The respirations are labored, uneven and unlabored. We're going to do the cytoph for reminiscence 99 again.
99, 99, 99, 99.
All right, then we're going to listen to the long sounds. Sorry, of the anterior chest. All right, great. So clear to oscillation as well. No adventitious sounds noted. While I have you sitting, sir, I'm going to go ahead and we're going to start with your heart. So we're going to listen to long sounds here. So you have your aortic, which is your second intercostal space, right sternum border. Your pulmonic, which is your left intercostal space. Your pulmonic is the left intercostal space, second sternum border. Your Earth point, which is your left sternum border, third intercostal space. Your tricuspid, which is the left sternum border, left costal space. Your mitral is the fifth intercostal space, left sternum border, which is your left midclavicular line. Also your point of maximum impulse, and where you will listen to the pickup pulse for 1 full minute. For the sake of time, we will verbalize that. We will also listen with the bell. So your aortic, which is your right intercostal space. Your aortic is the right sternum border, left second intercostal space. Your pulmonic is the left sternum border, left intercostal space. Your aortic point is the left sternum border, third intercostal space. Your tricuspid is the left sternum border, fourth intercostal space. And your mitral, again, is the fifth intercostal space, left sternum border, left midclavicular line. All right, the next thing I want you to do, sir, I want you to lay down right here for me. All righty. Bring the camera a little bit closer. All right, so as the patient is laying down here, you can see we're checking for jugular vein dissension. So at 30 degrees semi-phallic here, looking at the neck, we notice that there is no jugular vein dissension noted. Also, while the patient is laying down, we're going to go ahead and listen to those heart sounds again. So your aortic is the second intercostal space, right sternum border. Your pulmonic is the second intercostal space, left sternum border. Your Earth point is the third intercostal space, left sternum border. Your tricuspid is the fourth intercostal space, left sternum border. Your mitral is the fifth intercostal space, left sternum border, left midclavicular line, and you're also your point of maximum impulse, and then the point where you will listen to the pivotal pulse for 1 full minute. And then with the bell, aortic, pulmonic, Earth point, tricuspid, and mitral. All right. Also, while the patient is laying down, we're inspecting, making sure there are no heaves or lifts, which we do not see. We also going to palpate for any thrills here, which we do not feel, no vibrations there. Next, we're going to move over to the patient's abdomen. So I'm going to put up his shirt a little bit. So with the abdomen, we notice that the contour is flat, it's round, and it's a little bit protrudent here. We're going to go ahead and listen to him. Listen to the bowel sounds first. So with the bowel sounds, starting with the right lower quadrant, we know that the bowel sounds are normal, active in all quadrants. Next, we're going to also take for abdominal bruit. So you have your aortic, your renals, your iliacs, and then you have your femorals, which is no bruise noted there. Next, we're going to percuss. All right, so tympany is noted throughout. And then we're going to, the last thing we want to do is we're going to palpate for any tenderness. We do not feel any tenderness. We do not feel any masses. We're going to palpate for that liver, which we do feel, non-palpable here and no organelle. And then the spleen, the same thing. And then no organelle noted with the spleen. All right, you can sit up for me, sir. Turn your back this way. So with your back, we're going to check for the last part of the abdominal. We're going to check for CVA tenderness. All right, so no tenderness is noted. All right, great. All right, so the last part of the exam we're going to do, we're going to move to the musculoskeletal system here, sir. I want you to get that stool. We're going to have to sit back up here on the stool. All right, so with the musculoskeletal system here, we're looking for any signs of crepitus, which we do not see, appears to see. No knowledge, no deformities, no redness, no swellingness, no tenderness. We're going to start off with your upper extremities. So here we're going to assess for capillary refill, which we know that the capillary refill is less than 3 seconds in the upper extremities in the hands. We're going to palpate those radial pulses, which are 2 plus bilaterally. Next, we're going to do some full range of motion in the joints. So for the joints, for your hands, we're going to do flex, extend, hyperextend, abduction, adduction, and then thumb opposition. For your wrists, we want you to do flex, extend, hyperextend, radial deviation, honor deviation, and rotation. For your elbows, flex, extend, hyperextend. All right, and then for your shoulders, what I want you to do is flex, extend, hyperextend, internal rotation, external rotation, abduction, adduction, abduction, adduction, all right, and then circumduction. All right, great. Next, we're going to test for strength. I want you to squeeze my fingers for me. Okay, strength is 5 out of 5 in the hands, and then for your elbows, I want you to bend these for me. Push against me, pull it, okay, and then back in. A 5 out of 5 in the strength of the elbows. And then for your shoulders, I want you to pull out your shoulders like this, what we call the shoulder girder. All right, and then I want you to push up and then push down. So 5 out of 5 against resistance. All right, and then your arms down, please. All right, so, and then I want you to shrug your shoulders. Cranial nerve 11, which is your accessory muscle. So that's 5 out of 5 against resistance. And so far, all full range of motion in the hands, the elbows, and the wrists, in the upper extremities. Then we want to test a couple of different things here. So the first thing I want to do, I'm going to do stereogenosis. So I'm going to put an object in your hand, and I want you to tell me what object did I put in your hand. Close your eyes for me.
A bracelet.
Okay, that's the right hand, and then the left hand.
An ink pen.
All right, then we're going to test for graphophagia. Tell me, what did I write in your hand?
An X. X.
All right, great. Also, we've noticed that you can open your eyes. We noticing that the warmth, this temperature is warm. The color is appropriate. There is no edema. There is no swelling, and there's no tenderness of the upper extremities. We're also going to test for sensation. So sensation, we want to tell me where I'm touching you.
Forearm, hand, legs.
All right, so full sensation in all upper and lower extremities. And then we're going to test for vibratory sensation. All right, so we have the wrist. We have the brachioradialis. All right, and then we have the medial malleolus. All right, and sensation, vibratory sensations is expected. Next, we're going to test the deep tendon reflexes here. So we have the brachioradialis, which is 2+ in both extremities. Your biceps, your triceps, all are 2+. Your patellar, all right. Your Achilles, all right. And then we're going to do the Babinski's. So deep center reflexes in all places is 2 plus for that. The next thing we're going to do, we're going to test for some cerebellar coordination movement. So with that, sir, what I want you to do, I want you to do finger to nose. All right, touch my finger. All right, other hand. All right, great. All right, so then I want you to do pronation, supination, and hand flip flop. Okay, all right, great. And then also, all right, thumb opposition, 0 finger opposition. All right, great. All right, then we're going to move over down to the lower extremities. So for the lower extremities here, we have your, we're going to test for range of motion in your toes, your ankles, the knees, and the hips. So again, looking for any crepitus, no deformities, no redness, no swelling or tenderness noted. Looking at the color, the warmth, and temperature, that all is intact. We're going to assess your dorsifidiolis pulses are 2 plus bilaterally. Your posterior tibialis is 2 plus bilaterally. The capillary refill here is less than 5 seconds. All right. So for your toes, I want you to flex, extend, hyperextend, abduction, adduction. For your ankles, plantar flex, dorsiflex, eversion, eversion, and rotation. All right. So, and then while you're sitting, I want to test for your strength of your feet. So just plantar flex, both of them, dorsiflex. All right. So full strength in your feet. And then for your knees, I want you to push them up, push them down. All right. So strength is 5 out of 5 in the knees. For your hips, in and out. So strength is 5 out of 5 in the hips. All right, great. The next thing I want you to do, I want to test for full range of motion in your knees. So I want you to stand up for me and mimic these movements. So we have flex, extend, hyperextend for your knee. The other leg, flex, extend, hyperextend for the knee. All right, so strength is 5 out of 5 for the knee. And then for your hips, I want you to flex, extend, hyperextend, abduction, adduction, inversion, eversion, and circumduction. All right, and then the other one, flex, extend, hyperextend, abduction, adduction, inversion, eversion, and then rotation or circumduction. All right, good. All right, so that's it for that. Then we want to move over to your cervical spine. So with your spine here, we're noticing that there is no curvatures, there's no concerns for kyphosis, lordosis, or scoliosis. So spine is symmetric. We want to test for the cervical. So you do your flex, extend, hyperextend, lateral reflection, and then rotation. And then your lumbar spine, lean over and try to touch your tiptoes for me. All right, so you flex, extend, come back, hyperextend, lateral reflection, and then rotation. All right, then we want to test for looking at your, what we call the rhomboid gait. Close your eyes for me. All right, and then pull out your arms. Put your feet together. All right, and as the patient is doing that, we see no swaying, and that is the negative rhomboid test. Then I want you to ride a walk, starting right here, walk regular for me. Just walk regular. All right, and then come back and walk heel to toe. All right, so good. That's the tandem gait, and that appears to be no concerns for that. And then the last thing I want you to do, I want you to hop on one foot for me, like this. All right, great. All right, thank you so much for your time. This includes my head to toe assessment, Elizabeth Carter. Have a good day. Thank you.